Hi everyone, welcome to Lamp Clinics, presented by Lamp AccuWellness Foundation Inc., featuring common cold. Today we have a 32-year-old female patient whose chief complaint is headache and fever. 1 week ago, the weather became colder and the patient neglected to dress warmly. She developed a fever of 38 degrees Celsius with intermittent sweating. When she sweated, the temperature went down, but when the sweating ceased, the temperature rose. She had an aversion to cold, nasal obstruction with watery discharge, and a headache with a heavy sensation around the head. Her limbs felt heavy and sore. She was not thirsty, her appetite was poor, and she felt nauseated and vomited once after experiencing fullness in the epigastrium. Her stools were unformed, bowel movement once or twice per day, and urination was normal. Tongue, pale body with a white greasy coating, slightly yellow on the root. Pulse is soft. Now let's analyze the symptoms. Aversion to cold and fever signifies invasion of the superficial tissues by pathogenic factors. Intermittent sweating means dysfunction of the pores. Nasal obstruction with watery discharge is brought on by stagnation of the lung qi. Heavy sensation in the head and limbs is brought about by retention of dampness in the superficial tissues. Fullness in the epigastrium, nausea and vomiting, poor appetite, and unformed stool would mean poor circulation of qi due to retention of dampness in the middle burner. Pale tongue with white coating signifies cold. Greasy tongue coating and soft pulse would mean dampness. Basic theory of case. Dampness as a cause of disease can be external or internal, depending on the way in which it attacks the body. Its nature may be either damp cold or damp heat. Dampness alone has the following characteristics. It is a yin pathogenic factor which readily consumes the yang qi of the body. It is a substantial pathogenic factor, heavy and viscous, and may impede the normal circulation of qi, causing stagnation and sometimes even reversal of qi. Dampness also causes a sensation of heaviness when it is retained in different parts of the body. Dampness is thick and greasy and is therefore more difficult to remove than the other pathogenic factors. The history is therefore often rather long. The spleen has the function of transporting and transforming water. Both external and internal dampness readily injure spleen qi. Cause of disease is pathogenic cold and dampness. The patient has a history of exposure to pathogenic factors, which after 1 week of intermittent sweating are still present in the body. This fact, accompanied by the symptoms of heaviness in the head and limbs and the digestive problems, suggests that cold and dampness are present. Site of disease, superficial tissues, spleen and stomach. The aversion to cold with fever and intermittent sweating indicates that the site of disease is on the skin, pores, channels, and collaterals. The poor appetite, fullness in the epigastrium, nausea, vomiting, and loose stools show that the spleen and stomach are involved. Pathological change. Cold and dampness have invaded the surface of the body, confining the protective chi to a deeper layer. As it struggles to reach the surface, heat is produced. Aversion to cold and fever therefore occur at the same time, but since the yin pathogenic factor predominates, the aversion to cold is more marked than the fever. Sweating means that the yang qi expresses body fluid through the pores. When pathogenic factors invade the body surface, sweating can remove them through the pores, which is one way to expel exterior disease patterns. In order for sweating to be adequate for this purpose, the yang qi must be strong, and there must be sufficient body fluids. If the temperature returns to normal after sweating, this means that the pathogenic factors have been completely expelled and recovery will follow. Some pathogenic factors are more difficult to remove than others. Dampness has the characteristic of being thick and greasy, and is therefore difficult to remove once it is retained on the body surface. It tends to block the circulation of qi, leading to obstruction in the channels and collaterals. This in turn prevents sufficient yang qi from reaching the body surface to cause enough sweating. The clinical manifestation is that although some sweating occurs, the symptoms associated with pathogenic dampness nonetheless persist. In this case, which is typical, the patient has some sweating but continues to have a high temperature. Pathogenic dampness will cause blockage of qi passage that will lead to stagnation of channels and collaterals, and will cause invasion of body surface, therefore causing dysfunction of the pores and opening and closing. The patient also has a sensation of soreness and heaviness about the face, head, and limbs because the pathogenic dampness retained on the surface of the body impedes the circulation of qi and blood in the channels and collaterals. Thus, the clear yang cannot ascend to the head or reach to the body surface in general. There is nasal obstruction and discharge because the stagnation of protective qi leads to stagnation of lung qi. The spleen is one of the organs responsible for water metabolism. Pathogenic dampness can interfere with the spleen qi and causes stagnation of qi in the middle burner, manifested as fullness in the epigastrium. The spleen's function of digesting food is impaired, leading to poor appetite. The stomach qi fails to descend, and reversal of the flow of qi causes nausea and vomiting. Because the dampness is not properly transported by the spleen, it goes down to the large intestine, where it causes loose stools. The pale tongue and white coating reflect the presence of cold. The greasy quality of the coating and the soft pulse are associated with dampness. Pattern of disease. Because the pathogenic damp cold is retained on the body surface, the patient has fever and an aversion to cold, indicating an exterior pattern. The dampness has influenced the spleen and stomach, meaning that the pattern in this case is also interior. The patient has an obvious aversion to cold, nasal obstruction with watery nasal discharge, absence of thirst, and a pale tongue with a white coating. The pulse is soft but not rapid. These symptoms reflect a pattern of cold. The history is not very long, and all the symptoms involve the body surface and the spleen and stomach, and are caused by pathogenic dampness. This is a pattern of excess. Is there any evidence of heat in this case? A white tongue coating indicates cold, while yellow indicates heat. In this case, the coating on the root of the tongue is slightly yellow, suggesting that the dampness has a tendency to transform into heat. The dampness blocks the circulation of qi, and the yang qi struggles against the dampness, producing heat and causing part of the tongue coating to change from white to yellow. This kind of heat is not strong and is limited to a certain area. Thus, the general condition of the body is not affected. It can therefore be ignored in terms of diagnosis. Is there spleen qi deficiency in this case? The patient has a poor appetite, loose stools, and a pale tongue with a white coating, but the history is short, only 1 week. These symptoms are caused by dampness obstructing the spleen and stomach qi. In the case of spleen qi deficiency, the history would be much longer and the symptoms more severe. How is invasion by pathogenic cold and dampness distinguished from invasion by cold? Pathogenic damp cold and cold are both yin pathogenic factors, and both readily injure the yang qi of the body. When pathogenic damp cold invades the surface of the body but does not affect the spleen and stomach, the primary manifestations will be a severe aversion to cold, a mild fever, and an absence of sweating. The same is true of pathogenic cold. However, they may be distinguished by the fact that cold causes constriction and hence stagnation and poor circulation of qi and blood in the channels and collaterals, leading to aching in the head and body. Damp cold, on the other hand, is heavy and greasy, and when it invades the channels and collaterals and interstices and pores, the patient will have very pronounced symptoms of heaviness in the head, trunk, or limbs. Pain is either absent or of little significance. Conclusion. According to the 8 principles, this pattern is both exterior and interior, but mainly exterior, cold and excessive. According to etiology, invasion of superficial tissues by pathogenic cold and dampness. According to organ theory, impairment of spleen and stomach qi by pathogenic dampness. Treatment principle: expel the pathogenic cold and dampness and remove the symptoms of the exterior pattern. Remove the dampness and harmonize the middle burner. Selection of points. Governing vessel 14. Ta Chui. Triple burner 5. Wai Guan. Gallbladder 20. Feng Chu. Governing vessel 9. Chu Yang. Governing vessel 14 is the meeting point of the 7 yang channels and will regulate the qi around the yang channels and strengthen the protective qi in order to expel the pathogenic factors. Governing vessel 13 can be used to remove pathogenic heat, but because it acts on the natural resistance of the body, it is also a very good point for expelling other pathogenic factors. Triple burner 5 is the meeting point of the triple burner and the yang linking vessels, one of the 8 confluent points. Using this point thus causes the qi to flow from the triple burner, which is internal, to the yang linking vessel, which is distributed on the yang or external aspect of the body. This improves the circulation of yang qi on the body surface and tends to push the damp cold out through the pores. One function of the triple burner channel is the regulation of water metabolism. Use of this point will thus also remove internal dampness. Gallbladder 20 is used in this case as a local point because the patient has a heavy sensation around the head with headache. Its use will help remove obstruction and regulate the qi of the head. Governing vessel 9 is chosen to remove obstruction from the channels and collaterals by promoting the circulation of yang qi. Governing vessel 9 is useful for removing dampness and also in harmonizing the spleen and stomach because it is, in effect, a local point. It is an excellent choice in this case because there is both heaviness in the limbs and abdominal symptoms. This patient was treated daily for 3 days with the same points. The temperature gradually subsided to normal, but the appetite remained very poor. After 3 days, the points were changed in order to better remove the dampness and harmonize the spleen. Conception vessel 11, Qian Li, stomach 36, Zhu San Li, spleen 9, Yin Ling Chuan. These points were used on alternate days for 3 more treatments, after which the patient felt well. Thank you very much for your attention. Hope to see you in our next videos.